what are we doing right now with AI? And, a revolution is being promised, right? So is a revolution coming? And what are you doing yourself or in your companies or labs to make that promise of AI in drug discovery?
So what we are working on is we use digitized images of pathology samples, for example, a breast biopsy, prostate biopsy, and pathology really has not changed in 150 years. They literally do the same thing in 90% of places in the US as they did 150 years ago when Rudolf Virchow invented it more or less in Berlin. So it's very subjective, but it's of course the critical point because you don't have cancer until a pathologist says so. So it depends on the pathologist what kind of treatment you get, what drug you get, and so forth. So AI can help on many levels here, of course, to make it more objective and also more personalized. We built these large machine learning models to not only detect cancer, classify it, but also, again, predict sometimes underlying morphological changes, underlying genomic changes that lead to morphological changes.
Yeah.
In 2021, we got the first breakthrough designation for an AI in all of oncology. And 2 years later, that led to the first approval of an AI in pathology. And these days, we build much larger foundation models from millions of these slides, billions of images. So the last one, for example, it's named after Virchow, we used 10 times more data than all of Netflix. So think of all the shows you watch, all the movies, all the episodes, every single pixel. That's just 10% of the pathology data we pipe through.
Wow.
And at that level, you now have a frontier model that understands morphology of cancer and normal tissue at a very meticulous level. And you can use it for CDXs, for biomarkers, for trial enrollment, for example. And then, of course, diagnostics far beyond prostate and breast, but also for rare diseases.